Hi, I'm Dr. Paul Varnes, and in this video, we're going to show you how to market a specific issue. All of our marketing materials that are free to you, by the way, from Zorex, have either 2, 3, or 4 basic pieces. And the basic pieces are a newsletter, a report, a quiz or a questionnaire, or a poster. The most fundamental system will just have a newsletter and a report. And I'm here to nag you about internal marketing. It's cheaper. It's very expensive to attract strangers to your office. But I bring it to your attention because it's vital for you to prepare your waiting room. Throw out magazines. People Magazine has drug ads. You don't want anything in there that doesn't have to do with your practice. You have a captive audience, so only have materials about your practice, newsletters, reports, things like that. Another way they use these materials for marketing is something called co-op, okay? And that is finding a business, preferably related, like a bike shop or a health club, something like that, okay? Look through your patient base and see if someone has a business, even if that's not related. I mean, a barber shop or something would be good. And ask them to post your materials, translated newsletter. It's the cheapest, easiest piece to put around. People keep newsletters, they throw away brochures, and then offer the proprietor something in return. Make it good. Common thing is I'll post your stuff in my office, but you can get a little creative, especially if you're a new doc. You can offer to treat somebody for free. We have a weight loss program, so if you have somebody who's overweight, we've got a really good weight loss program. It doesn't involve dieting, but we're strike a deal. The more places you get your materials, the more patients you're going to get. Okay, this group of materials is going to be for low T. 25% of men over 30 have low testosterone, and if they have it, they're interested in what you have to say. Okay, testosterone levels drop 1% a year after the age of 30. The medical treatment is worse than the disease. It's a marketing ploy by the pharmaceutical industry, and a lot of doctors think that that's all it is money making. They don't see any clinical value in it at all. However, naturally, you can do quite a bit. It's linked to insulin insensitivity, and there's herbal remedies, and we have a whole program for you. Or at the very least, post it in your waiting room, or and I should say not or in a compatible business. And like I said, the newsletter offers a free quiz. The quiz is available from Zorex too. It also has text boxes that you can write in. Um, and it gets a co-op clients into your office, which is a good thing. Or your existing patients will add a service and make extra money. And chances are they'll make a referral. Uncle Sid needs this help. It'll grow your practice, and it hasn't cost you anything. The quiz directs them to get a report, which is also free. These are going to be printed up from Zorex, and they'll send them out to you. But you also have the same type of document. You can put your information on it and email it and things like that. And it's also good clinically for you. It keeps you from being too busy. It answers every possible question that the patient might have. It outlines the program. It tells them why the program. It's even got a food plan there for them. This takes no time for you once they start this. In fact, in my years of practice, I always got tired of saying the same things over and over again. So we have this booklet which will outline a diet plan for anybody with inflammation, which is literally in all of your patients. Okay, the booklet is free from Zorex with purchase, and you just give it to your patients. Say, here, this is how I want you to eat. It's got recipes, it's got meal plans. It'll save you a ton of time. And I'm Dr. Paul Varnes. I want to help you grow your practice. Email me, paulgvarnes@gmail.com. Call me. I'll get back to you if I don't answer. 773-519-0007. I really want to do this for you. And I spend all my time these days making marketing materials free for doctors. My goal is to change the health system. If I help you grow little by little, you see more patients get dissatisfied for our pathetic medical system, and it'll ultimately do some good. Thank you. I know your time's valuable. Please contact me.